Snow had turned Chicago into a blur of white and flashing color. Outside St. Gabriel Medical Center, the parking lot was a patchwork of ice exhaust and red-blue lights sweeping across the storm. Wind shoved against the glass doors as if it wanted in. Inside, the emergency department already felt too full. Monitors chirped and screamed. Overhead announcements crackled. Shoes squeaked on wet linoleum where melted snow mixed with drops of blood. Maya Reyes tugged a curtain closed around bed 6 and stripped off her gloves. Her fingers were stiff with cold sweat. A faint white scar curved across the inside of her left wrist. Under the harsh fluorescent lights, it showed like a thin crescent of moon. "You good, Reyes?" The charge nurse, a big guy named Alton, passed by with a stack of charts. He did not slow down. No one did tonight. "Yeah," Maya answered, breath fogging just a little in the overworked air conditioning. For now, her heart was still catching up with her body. The last patient, a middle-aged man with chest pain, was on his way upstairs with a cardiology team. He had walked in, clutching his shirt eyes wild. 10 minutes of organized chaos had turned panic into a plan, pills and wires and forms. It had felt almost easy. Easy made her nervous. She tossed her gloves into the biohazard bin and stepped toward the nurse's station. The air smelled like antiseptic coffee that had sat too long on a burner wet wool from coats hung in a corner. Somewhere a child cried thinly. Somewhere else someone argued in Spanish about waiting times. The central monitor above the station showed 12 green lines, each one jumping, dipping, tracing the story of a different heart. Each beep cut through the storm of voices like a metronome with no rhythm. Maya found herself watching the lines for longer than she needed to, eyes tracking them the way someone else might watch a game. "Reyes, you chart that troponin redraw," one of the other nurses called. "Working on it," she said. She sank into a rolling chair and woke up a computer. Her fingers moved across the keys automatically. Name, time, dosage. She wrote clean, precise notes, the kind her instructors used to praise. Her mind refused to stay inside them. The storm pressed itself against the glass of the ambulance bay doors. Every time they slid open for someone, a knife of cold air slid in with them, raising the hairs on her arms. She paused, stared at the double doors, and for a second they shimmered. Sand instead of snow, a canvas flap instead of glass, heat that smelled like diesel and gunpowder. A shout from behind her snapped the picture. The storm came back. The doors were just doors. "You spacing out on me, Reyes?" The voice belonged to Dr. Adrian Cole. He walked up from Trauma 2, peeling off his gown. He was tall, shoulders narrow, and straight dark hair shot with the first hints of gray at the temples. The lines at the corners of his eyes were not from smiling. His name badge swung against his chest when he moved Cole MD Trauma. Maya closed the chart and stood. "Just checking labs," she said. Cole gave the monitor board the sort of quick scan that made the residents step aside. "Bed 3 stable," he asked. "Post-seizure sleeping," Maya answered. "And bed 8. Post-op complication. BP made a run for it, but we pulled it back." Cole nodded once. Every answer she gave slotted into his mental map. "You handled that nitro drip well earlier," he said almost as an afterthought. "Many new nurses fled the line." "Had a good teacher," Maya replied. He did not ask where. He did not know there had been no line, only a plastic bag hung from a rusted nail and a flashlight held between her teeth. Behind them, a resident laughed too loudly at something in the hallway. Somewhere a metal tray clattered to the floor. The sounds folded back into the white noise of the department. Cole checked his watch, a heavy silver piece that caught the light. "Storm is going to slow everything down," he said. "Traffic, transports, people will come in late, but they will still come." Maya listened as he spoke, but she was hearing something else too. The pitch of the alarms, the rhythm of footsteps, the way the building itself seemed to vibrate when a stretcher was pushed too fast. Her hands itched. Not in a bad way. In the way they always did when the air changed just before something went wrong. She glanced down at them. The scar on her wrist, the ridges of callus on her fingers that no amount of lotion could soften. Sometimes people assumed they came from weightlifting or rock climbing. She never corrected them. "You should hydrate," Cole said suddenly. "You have been on your feet for 10 hours? 9, she said, and a half. He gave a small huff that might have been a laugh. "Go take a sip of water before the next wave hits," he said. "You cannot fix anyone if you hit the floor first." "Yes, doctor." He had already turned away by the time she answered. He walked with quick efficiency toward another bed, hand already reaching for a chart. Maya stepped into the tiny break area behind the nurse's station and filled a paper cup from the cooler. The water tasted faintly metallic. She leaned her hip against the counter and let herself breathe just for a moment. Outside the narrow window, the world was a smear of white and red. Snow fell sideways in thick sheets. The lights from the ambulances and street lamps flared and blurred behind it. The sirens were muffled by glass and snow, but she could still feel the vibration of them deep in her chest. She closed her eyes. The vibration became something else, rotor blades thudding overhead, canvas walls snapping in hot wind, men shouting in Arabic and English over the whine of engines. Her hand tightened on the paper cup. Water sloshed over her fingers, cold, bringing her back. Not here, she told herself, not now. She tossed the cup and wiped her hand on her scrub pants. When she stepped back into the main hall, the noise of the department washed over her. A man cursing softly as a nurse started an IV. The rhythmic click of a keyboard. A television in the waiting room talking about the storm. At the charge desk, Alton was on the phone, his voice brisk. "St. Gabriel receiving," he said. "Go ahead." Maya moved closer without meaning to. Her body seemed to know before her brain did that this call mattered. Alton listened, his expression tightening. He scribbled something on a pad and repeated it back. "Male, late teens, gunshot to the abdomen, hypotensive, en route 5 minutes out." The words snapped into the room like a rubber band. Maya felt them more than she heard them. Her pulse picked up. Her hands relaxed, then flexed. Alton hung up and raised his voice. "Trauma coming in. Dr. Cole, you are on. Teenager abdominal GSW unstable. 5 minutes." The movement around the station shifted. Nurses broke off conversations mid-sentence. A resident abandoned a half-eaten granola bar. Someone pulled on a fresh pair of gloves with a snap. Maya did not think. She stepped forward. "I can take the primary nursing role," she said. Alton looked her over the way a coach might look at a player about to be sent back in. His eyes flicked once to Cole, who was already heading toward Trauma 1 tying a new gown. "Fine," Alton said. "Reyes, you are with Dr. Cole and Dr. Patel. Trauma 1, move." She nodded, already walking. As she passed the central monitor, the green lines and their steady beeps faded into the background. Somewhere one of those lines belonged to the boy who was coming. Somewhere another line might soon go flat. Maya flexed her fingers once more and pushed through the swinging doors toward the trauma bay, the storm's dull roar following her down the hall. Trauma 1 was already open, lights bright, the bed stripped and waiting. Maya slipped a fresh pair of gloves over damp hands. The room smelled sharper here, like metal and bleach. A portable ultrasound machine stood ready in the corner, its screen black. A warmer hummed with stacked blankets. The big round clock above the door ticked loud enough to cut through the low murmur of voices. Dr. Priya Patel stood at the foot of the bed, flipping through a thin chart the clerk had just printed. Her hair was pulled into a tight knot, not a strand out of place. Her gaze moved quickly, lips pressed in a straight line. "Name?" she asked. "Unidentified for now," the clerk replied. They called it in as male late teens, no ID found at the scene yet. Priya clicked her tongue softly, then looked up as Maya approached. "Ray is right," she said. "Yes, doctor." "You have trauma experience." Priya's tone was neutral, almost curious, but her eyes were weighing. "A little," Maya said. Priya held her gaze a second longer than necessary, as if she had heard something too vague in that answer, then looked away. "Vital signs when the call came in," she asked the clerk. "Systolic in the 70s, tacky. They said he is pale cool, still talking, but out of it." Priya frowned. "Talking is good," she said, "for now." The doors at the far end of the hall slid open with a hard hiss. The pitch of the department shifted. The storm outside pushed a gust of cold air in ahead of the stretcher. Maya stepped to the head of the bed beside the anesthesia cart. Her fingers checked the laryngoscope blades, the suction, the bag valve mask, each motion quick and habitual. She could feel her own pulse in her throat. Footsteps pounded near, voices rose. "On 3, someone yelled. The stretcher crashed into the room, its wheels rattling over the threshold. The paramedics wore orange reflective stripes wet with melting snow. Between them lay a boy. He was younger up close than the words late teens had sounded. Brown skin lashes dark against his cheeks. A black hoodie soaked through at the abdomen, the fabric stiff with blood. His jeans were torn at one knee, exposing a strip of skin dusted with gray slush. 18, maybe, the taller paramedic said as they shifted him to the hospital bed. Found on the sidewalk outside a pizza place on the 79th. Single gunshot to the lower abdomen. Entry wound here. Wound. He pulled the hoodie up just enough to reveal a hole just to the left of the navel, ringed with ragged flesh and fresh blood. Blood pressure dropping on the way in, the other medic added. We got one large bore in his left AC wide open. He has gotten a liter of saline. He is not liking it. The boy groaned as they moved him. His eyes fluttered open, unfocused. The whites showed in a way Maya did not like. "Sir, can you hear me?" she said, leaning in. His gaze flickered toward her voice. "Where is Malik?" He whispered the words thick. "We will find out, but right now, I need you with me," Maya said. "You are in the hospital. You got hurt. We are working on you." A thin silver chain lay against his neck, half buried under his hoodie collar. A small charm shaped like a basketball jersey hung from it, the number 11 etched in blue. Her gloved fingers brushed it as she adjusted his gown. "Name is Jamal," the paramedic said. "His friend yelled it about 6 times before we pulled out." Jamal, Maya repeated, close to his ear. I am Maya. Stay with us. Dr. Cole entered as if drawn by the scent of blood. He pushed the door with his shoulder already in a new gown and mask around his neck, stethoscope draped across his shoulders. What have we got? He said. Priya rattled off the facts in crisp bursts. Male around 18, single abdominal gunshot hypotensive, one large bore IV with fluids, tachycardic, GCS 13 on arrival. Let us see it, Cole said. He snapped on goggles and stepped to the right side of the bed. Maya moved slightly to give him room, hands still bracing Jamal's head and keeping the airway in line. Jamal shivered. The hoodie was cut open in one motion with trauma shears, then peeled away. His chest rose quickly, each breath shallow and fast. His abdomen was taut, distended in a way that sent a cold thread through Maya's spine. The entry wound oozed dark blood. Around it, the skin was already turning dusky. 98.6, one nurse called out. Heart rate 150, blood pressure 68/40. Cole's eyes flicked toward the monitor over the bed. The green line jumped fast and uneven, the numbers in the corner a sour yellow. Airway is patent, Maya reported. Breathing is labored but present. No obvious wounds to chest. Breath sounds both sides. She pressed the stethoscope to his lungs, listening carefully. Air moved in and out, noisy but equal. Circulation is crap, cause, Cole said. Priya, get the fast going. Alton's second large bore IV, right AC. Type and cross for 6 units stat. Call the blood bank and tell them we will be friends tonight. Order snapped through the room. People moved. Drawers opened and closed, plastic crinkled. Maya watched his face. His lips were dry, cracked a little at the corners. There was a faint shadow of peach fuzz on his chin that said he had not yet mastered a real beard. One of his hands twitched, fingers curling inward. She slipped her hand into his and felt how cold his skin was compared to her own. Jamal, she said quietly. Can you tell me your last name? His tongue moved against his teeth. The word came out soft and slurred. Carter. Good. Do you know where you are? Hospital, he mumbled. Exactly, good job. His eyes rolled, then came back. He seemed to be fighting sleep. Do not let him go out, Priya said, Gel already on the ultrasound probe. Talk to him. Maya nodded. Jamal, that jersey necklace is nice, she said, keeping her voice light. You play. He blinked as if the question had to travel a long distance. Point guard, he whispered. State this year, if we make it. We are going to need you awake to run plays, she said. Stay with me. His lips moved into a ghost of a smile. The probe slid over his abdomen. On the screen, shades of black and gray flickered. Cole leaned in, watching. Right upper quadrant, Priya murmured, eyes narrowed. Free fluid, left upper quadrant the same, pelvis full. That is a lot of blood in all the wrong places, Cole said. We need the OR. He lifted his head. Call surgery, he said. Oh boy. Tell them we have a belly full of blood and no time to argue. The circulating nurse was already at the phone. She dialed with quick practice jabs. Maya felt Jamal's fingers twitch again in her grip. His hand was slick with sweat now, but his skin was cooling. The monitor beeped faster. BP is 60/palp, another nurse said. Norepinephrine is starting. Open the second unit of O negative, Cole replied. Get it in. The blood bag hung heavy and dark. Tubing dripped red when the clamp slid open. Maya remembered crimson in a plastic bag hanging from a nail in a tent, the way the line had kinked in the heat, the way a boy's eyes had rolled back before she could clear it. She swallowed. Talk to me, Jamal, she said. He tried. The words came loosely. Coach Dick is going to kill me, he murmured. He can yell later, Maya said. Right now we focus on you breathing. His eyelids fluttered. The numbers on the monitor flicked lower, then bounced, then dipped again. Priya glanced up from the ultrasound machine. His abdomen is getting tighter, she said. He is tamponating himself, but it is not enough. He is bleeding like crazy in there. Where is my OR? Cole asked through his teeth. The nurse on the phone winced. They are finishing a ruptured topoideus, she said. Anesthesiology says 20 minutes minimum before they can flip the room. Cole stared at her, then at the ceiling, as if he could see through it to the floor above. We do not have 20, he said. Maya felt it too. Jamal's pulse in his wrist was a rapid flutter, weak under her fingers. His skin had taken on that particular shade between gray and yellow that she had seen before on stretchers made of canvas and on floors made of dirt. Can we send him to the other hospital? One of the residents asked from the doorway. St. Mary's might have an open room. In this storm, Cole shook his head sharply. He will die in the back of an ambulance before they hit the ramp. The room seemed to shrink. The hum of machines filled the gaps between words. Maya kept her voice low, just for the boy whose hand she held. Stay with us, Jamal, she said, just a little longer. His eyes cracked open a sliver. There was fear there now, clear and bright. I do not want to die, he whispered. The words hung in the space between his mouth and her face. For a heartbeat, everything else in the room blurred. Her chest tightened. Her hand tightened in his. She could feel the thin bones of his fingers under her glove. "We are not done yet," she told him. Behind her, Cole spoke again louder. "All right," he said. "We buy time. We do what we can from here. Keep away. Keep the fluids going. Keep the pressors going. Everyone stay sharp." Maya nodded without meaning to. Her gaze never left Jamal's face and his never quite focused on hers, but he clung to her voice as if it were the only solid thing in the room. The first 10 minutes felt like a fight with no target. Blood ran down the tubing in a steady red line. The pump hummed as it pushed fluid into Jamal's veins. The monitor over his head spat out numbers that refused to settle. "Heart rate 160, a nurse called. "Pressure 60 over 30. "Up the pressor," Boss Cole said. 5 more micrograms. Priya watched the ultrasound screen again, one hand on the probe, the other braced against the bed rail. "Free fluid is increasing," she said quietly. "All quadrants. It is just pouring in there." Maya could see it without the screen. Jamal's abdomen rose higher with each breath. The skin stretched shiny over muscle, the curve of it wrong. She could smell the mix of blood and antiseptic, feel the heat radiating from his core, even as his hands stayed cold in hers. Jamal blinked at the ceiling, his pupils slow to track. His breaths came in shallow pants. "Coach is going to bench me," he muttered, voice wandering. "Missed practice." Maya squeezed his hand. "Focus on breathing, not on your coach," she said. "In through your nose, out through your mouth. Try with me." She exaggerated her own breaths so he could hear them. His chest rose and fell in something close to her rhythm, then drifted away. "Recheck his lungs," Cole said. "He might be tipping into something worse." Maya leaned in with the stethoscope again, sliding it across his chest. Air still moved on both sides. No crackles, no sudden silence. "Lungs are clear," she reported. "Breath sounds present bilaterally." "Then the belly is the problem," Cole said. He spoke like he was narrating for himself as much as for the team. The words were a way of carving order out of the mess. Maya watched the bag of saline empty, the plastic walls collapsing inward as the last of it rushed into Jamal's body. She watched the monitor jump a single point, then slide back down. It felt like bailing out a sinking boat with a paper cup. "Doctor," she said before she could stop herself. Cole did not look up from the wound he was packing with fresh gauze. "Yes, Reyes." She chose her words carefully. "We are pushing a lot of volume into him," she said. "With how much he is bleeding inside, it might be making the hemorrhage worse." Cole's eyes flicked toward the ultrasound, then back to her. "We do not get to pick between bleeding and no bleeding," he said. "We pick between bleeding with a blood pressure and bleeding with nothing." His tone was calm, but there was a tight line around his mouth. He was not wrong. That did not make her any less uneasy. Priya slid the probe over a different quadrant, watching the dark pools on the screen. "He is autotransfusing to his abdomen," she said. "His belly is his third bag. Until we open it, that is what we have." Maya licked her lips. Her mouth tasted like old coffee and adrenaline. Her mind kept circling the same thought, the one her training here never mentioned, the one that belonged to another country and another set of rules. They could not open him yet. They could not stop the bleeding at the source. But there had been times before when even that had not been an option. Times when they had done something else. Her fingers tightened on Jamal's hand. The scar on her wrist ached, or maybe she only imagined it. "Dr. Cole," she said again, "I have seen a technique used when surgery is delayed. For abdominal hemorrhage. It is more targeted than just pushing on the outside." Cole's head turned toward her. Priya's did too. The room did not go quiet, but the feel of it shifted. "Where have you seen this?" Priya asked. Her brows lifted, the question hung between clinical and skeptical. "Overseas," Maya said, "in a field setting." "Field setting?" Priya repeated. "You mean like a volunteer trip?" Maya thought of the tents and the sirens and the sound of shells hitting too close. The word volunteer did not fit anywhere in that picture. "Something like that," she said. Priya gave a short, breathy sound that might have been disbelief. "Reyes, this is a level 1 trauma center," she said. "We have an OR, we have surgeons, we have imaging. We do not do improvised pressure tricks. We stabilize and we send them upstairs." Her voice was not raised. It did not need to be. The clipped syllables said enough. Maya felt heat rise under her collar. She was suddenly aware of how many pairs of eyes could see her, even if they were not looking directly. Residents, techs, nurses, all of them tuned to the hierarchy without thinking. "I'm not talking about guessing," she said, trying to keep her tone even. "There is a way to use internal pressure to slow a specific arterial bleed. Not forever. Just to buy time." Cole spoke before Priya could. "External compression on the abdomen in this setting risks more damage," he said. "You can crush bowel, you can tear more tissue. We do not have imaging of the exact vessel. We are not in a tent with no other options. We are here." He said here like it was a shield. Maya swallowed anything else. Jamal's fingers twitched in her palm, a small reminder of what mattered. Understood, she said. Priya looked back at the screen, then at Cole. I agree, she said. We stay in our lane, nurses manage lines and comfort, we handle the rest. The words stung more than Maya wanted them to. She kept her face neutral. Another bag of blood was hung dark and heavy. Another syringe of pressure slid into the IV port. The monitor complained in high stutters. Heart rate 170. Blood pressure 50 over something that barely registered. Jamal's lips had gone from pale to bluish at the edges. His breaths came faster, bordering on panting. Sweat beaded along his hairline, mixing with the dampness from melted snow. Maya dabbed his forehead with a corner of gauze. You are doing all right, she said quietly. You are fighting hard. His eyes moved under his lids. A soft sound escaped him that could have been a word. Mom, he murmured. It landed in her chest like a dropped stone. At the nurse's station, a phone started to ring. It kept ringing, cutting through the noise with its different pitch. No one in the trauma bay moved to answer it, but Alton stepped out and picked it up. Maya could not hear his side, only saw his shoulders straighten and his face change. He spoke into the phone, then lifted his head. Who is primary nurse on Trauma 1? He called. Maya half raised her hand without thinking. Reyes, she said. Alton covered the mouthpiece with his big hand. Family is on the line, he said. Mom, she says he is overdue. She has a tracker on his phone and it shows the hospital. For a second, everything inside Maya resisted. She did not want to leave Jamal's side. The pull of his hand, the pull of her duty, they warred for a heartbeat. Cole glanced at her. Go, he said. 1 minute, make it quick, then back here. She slipped her hand from Jamal's, pressing his fingers against the mattress as a poor substitute. I will be right back, she whispered. Keep breathing. He did not answer. His chest rose and fell, rose and fell. She stripped off one glove and took the phone from Alton at the desk. St. Gabriel Medical Center, she said. This is Nurse Reyes. The voice on the other end broke on the first word. Is my son there? The woman asked. His name is Jamal Carter. His phone, it shows your hospital. No one will tell me anything. There was traffic noise in the background, the honk of a horn, the muted thud of music from another car. The woman sounded like she was driving too fast, and not fast enough. Maya closed her eyes for half a second. He is here, she said. He came in recently. Is he alive? The woman asked. The question was so raw that it stripped away any polite phrasing. Yes, Maya said. It was true. He is alive. He is very sick. We are working on him with everything we have. A breath burst out on the other end, half sob, half relief. Is he in pain? The woman said. Does he know I am coming? Maya looked through the glass toward Trauma 1. She could see the top of Jamal's head, the movement around him. He is not alone, she said. We are giving him medicine to help with pain. He knows he is in the hospital. I will tell him you are on your way. There was a pause. Maya heard the woman sniff hard. He was just getting pizza, she whispered. He was just hungry. Maya's throat tightened. The fluorescent lights above her hummed too bright. Drive safely, she said. Come to the emergency entrance, ask for Jamal. Someone will bring you updates as soon as we can. She wanted to say more, something concrete to hold on to, but anything beyond that would be a promise, and promises had weight she could not carry right now. Please do not let my baby die, the woman said. The words crackled through the line and settled into Maya's bones. We are not giving up on him, Maya said. She hung up and stood still for a breath. Her heart pounded against her ribs. Her palm, the one that had held the phone, felt strangely empty. Alton looked at her. You all right? He asked. No, she said, but I am going back in. She pulled on a new glove and returned to Trauma 1. The room seemed smaller than when she had left. Jamal's skin was slick with sweat now. The sheet under him had been changed once, already stained again. The monitor alarm tone had changed pitch higher, more insistent. BP 40 over palp, someone said. Heart rate 180. If before 180. Priya adjusted the ultrasound depth, then finally pushed the machine aside. There is no point scanning anymore, she said. He is drowning in his own blood. Cole's jaw clenched. Norepinephrine is at max, a nurse added. Maya took Jamal's hand again. It felt lighter now, as if his body were shrinking away from her touch. Reyes, Priya said without looking up. You have to stay focused on your tasks. Fluids, lines, meds. Let us worry about the rest. Maya watched Jamal's chest hitch. Watched the numbers tilt in the wrong direction. Her mind replayed the field hospital, the improvised move they had used, the argument that had followed the boy who had lived long enough to reach a surgeon 3 hours away. It sat in her throat like a held breath. With his mother's voice still echoing in her ear, it became harder not to speak. Doctor, she said, her voice low but clear. If we keep doing only this, he is not going to make it to that OR. There is another option to slow the bleeding from inside. I can help. Priya's head snapped toward her eyes sharp. Reyes, this is neither the time nor the place for experimental ideas, she said. We are losing a patient. Dr. Cole has a plan. Cole rubbed a hand over his mouth, gaze pulled between the monitor, the wound, and Maya. The risk of causing more damage is high, he said. And we do not even know exactly which vessel is torn. We cannot go poking around in there without direct visualization. His words landed with the finality of a door closing. The room filled again with the sounds of machines and hurried breaths and the thin, stubborn beeping of a heart running out of road. The alarm over Jamal's bed changed from a complaint to a scream. The tone climbed pitch loud and sharp, drilling into the room. Red lights blinked at the corners of the monitor. Heart rate 190, a nurse called. Pressure is barely there. I am getting 30 over nothing. Cole leaned over Jamal's abdomen palms, pressing around the wound as he checked for any external source he could control. His gloves were slick with blood. Fresh gauze soaked through almost as soon as it touched skin. Turn that alarm volume down, he said. I know it looks bad. I need to be able to hear myself think. Someone reached up and tapped the silence button. The flashing stayed. Maya felt Jamal's fingers go slack in hers for a beat, then tighten again. His head rolled slightly to one side. His eyes were glassy pupils too big. Jamal, she said, look at me. His gaze did not quite find her. Priya checked his carotid pulse, her fingers firm at his neck. Thready, she said, like a hummingbird. Another unit, Cole ordered. Run it wide open. The nurse spiked a new bag of blood crimson flowing into the drip chamber, then down the line. The overhead lights glinted off the tube. Maya watched his chest. The rise and fall had turned shallow uneven, the muscles in his neck strained with each breath. She slid the oxygen mask tighter over his face. Deep breath, Jamal, she said. In, out, stay with us. His mouth moved against the mask. Mama, he murmured again, almost soundless. Maya heard it this time through the plastic. It sank into the space behind her ribs. At the foot of the bed, a resident hovered, clutching a clipboard like a shield. Should we intubate soon? He asked, before he tires out completely. Cole shook his head once. Not yet, he said. If we sedate him now, his pressure will vanish. We keep him breathing on his own as long as he can. He looked at the clock. Only a few minutes had passed since the last time he had demanded the OR. Call surgery again, he said. The circulating nurse picked up the wall phone, voice tightly controlled. Trauma 1 checking on OR availability, she said. The patient is actively crashing. Maya could not hear the voice on the other end, but she watched the color drain from the nurse's face. They are still closing the aneurysm, the nurse reported. They had an intraoperative bleed. They said 10 to 15 more minutes minimum. Cole closed his eyes briefly, then opened them. The only sign of strain was a twitch at his jaw. Tell them if they want a patient to operate on, they are going to have to move faster, he said. The nurse relayed it, then hung up. Priya stared at the monitor. Rhythm is starting to look irregular, she said. He is throwing PVCs. The heart tracing jumped and dipped, losing its pattern. The numbers next to it blurred as they changed too fast. Maya could feel the frantic pulse under her gloved fingertips, then suddenly it seemed to vanish. Doctor, she said. Before she could finish, the monitor shrieked again. The green line spiked into a chaotic scribble. The blood pressure reading turned into 3 question marks. He is in VTAC, Priya barked. We are losing him. Start compressions, Cole snapped. Get the pads on him now. The resident moved clumsily to the stool at the head of the bed, hands lacing together, then driving down into Jamal's sternum. His arms were not straight enough. His shoulders were too tense. Move, Maya said, voice low but firm. The resident startled and shuffled aside. She took his place, centering her hands over Jamal's chest. Muscle memory took over. Heel of palm straight, arms, shoulders stacked. She let her weight do the work, pressing down hard and fast. Ribs shifted under her hands. She counted under her breath in time with the compressions. The monitor rhythm fell into a flat, ugly line, then into tiny, chaotic spikes. A tech slapped defibrillator pads onto Jamal's bare chest, one high on the right, one low on the left. The machine chirped as it analyzed. Charging, the tech announced. Everyone clear on my mark. Maya did not stop until he said it. Clear. She lifted her hands, stepping back just enough. The shock jolted Jamal's body heels, lifting off the bed. The burnt hair and plastic smell hit a second later. Maya stepped in immediately, hands finding their position again, starting compressions. Sweat rolled down her neck and soaked into the collar of her scrub top. Epi is in, a nurse said. Mag is ready if you want it. Give the mag, Cole replied. Run it slow. Check a pulse after 30 compressions. Maya kept pressing, her entire world narrowing to the feel of his chest under her hands. Her shoulders burned, her wrists ached. She ignored both. Check, Cole said. She paused. Priya's fingers found Jamal's neck again. Faint, Priya said. Maybe, hard to tell. Continue compressions, Cole said. Maya went back to it, counting. breathing forcing blood through a failing system with the strength of her arms. The monitor flickered. A few hesitant complexes appeared, then dissolved. Her vision tunneled. Sweat stung her eyes. Somewhere behind her, someone adjusted the oxygen. Someone else changed out a bag of fluids. "Switch," Cole said finally. "Rhea, step out." "I can keep going," she said. "You will be useless if your arms give out," Priya replied. "Switch." A tech took over compressions. Maya backed up, chest-heaving hands still hovering as if reluctant to leave Jamal's body. She swallowed, tasting metal and cotton. She grabbed a towel from the warmer and wiped her forehead, then his. His face was slack now, eyes half-lidded, lashes damp. The silver chain at his neck had twisted the small jersey charm off to one side. The defibrillator charged again. Another shock, another jolt, another set of compressions. After 2 more cycles, the rhythm on the monitor shifted. The chaotic waves smoothed, reluctant but real. A sinus tachycardia crept back onto the screen. "Hold compressions," Cole said. "Check a pulse." Priya pressed her fingers to Jamal's neck. "I have one, have one," she said. "Weak but present. He is back." A low exhale moved through the room, not quite a cheer, not relief, just a collective breath that had been held too long. Maya stepped forward, hand trembling as she reached for Jamal's wrist again. The pulse beneath her fingers was a fluttering bird, but it was there. "Welcome back," she whispered near his ear. There was no sign he heard her. His eyelids did not flutter. His chest rose and fell under the ventilatory bag, now the resident squeezing it carefully in time with his heart. "Intubate him," Cole said. "We do not risk him tiring out again." This time, there was no argument about sedation dropping the pressure. They were already at the edge. Anesthesia had arrived, a calm man in blue scrubs who had slipped into the room during the code. He slid into position at the head of the bed blade, ready. Maya handed him the tube, then stepped aside, monitoring the oxygen saturation on the screen. The laryngoscope went in. Vocal cords appeared, then the tube passed between them. The cuff inflated, the ventilator was connected. The hiss and whoosh of mechanical breaths filled the space. "Tube is in," Maya confirmed after checking with her stethoscope. "Breath sounds equal, no gastric sounds." "Good," Cole said. "Secure it." Tape wrapped around plastic. The mask was removed. Jamal's mouth hung open around the tube jaw slack. His blood pressure crept up into the 50s again, then slid back toward the 40s. His heart raced above 170. The monitor continued its frantic stutter. Priya wiped gel off Jamal's abdomen and placed her hand lightly on the distended curve. "He is more rigid than before," she said under her breath. "If we put a needle in, I bet we get blood under pressure." "We already know that," Cole replied. "We need the source." "We need the OR," Priya shot back, frustration finally breaking through. "We do not have it," Cole said. The simple truth hung in the air like fog. Maya stepped closer to the bed again. The sharp smell of cautery from some other room drifted faintly down the hall. The fluorescent lights hummed overhead. She felt as if they were all standing at the edge of a cliff, watching the rocks crumble under their feet. Her chest rose and fell. The scar on her wrist prickled. She spoke before she could talk herself out of it. "Dr. Cole," she said, "the technique I mentioned, it is not guessing at random. You use anatomical landmarks to find and compress the aorta or its branches from inside the abdomen using gauze and a clamp. It slows the flow to whatever is damaged downstream. It can turn a gush into a trickle." Cole's eyes flicked to her, then back to Jamal's swollen belly. "Our imaging is limited," he said. "Our field of view is limited. We are not inside a wide-open cavity. If you misjudge a clamp, you can tear something that is still intact. With respect, she said, he is already bleeding out. What we are doing now is not enough. This could give him the 10 minutes he needs." Priya stared at her in disbelief. "Rhea's nurses do not reach into open wounds and compress major vessels," she said. "That is not in your scope of practice. That is not even in ours without the right setup." Her words came out crisp like snapping icicles. Maya swallowed. "In Syria," she began. "This is not Syria," Priya cut in. "This is Chicago, at St. Gabriel. We have guidelines here for a reason." The name of the city hit like a verdict. Here, there, the invisible line between. Cole straightened, stepping back from the bed for the first time in what felt like hours. He peeled off a pair of blood-soaked gloves and pulled on a fresh set, each snap of latex loud. "We are not going to experiment inside this boy's abdomen," he said. "Not while there is still a surgical team coming. I understand you have seen different things in different places. That does not make them appropriate here." His gaze held hers, not unkind but firm. Maya looked down at Jamal. The ventilator breathed for him. The monitor carved out the story of his heart in frantic peaks. She could feel the weight of Priya's earlier sentence pressing down. "Stay in your lane." Her jaw tightened. "Understood," she said again, though the words scraped her throat. Silence spread across a few seconds. Only the mechanical sigh of the ventilator and the relentless beeping filled it. Then the monitor screamed again. The heart rate dropped not upward this time, but downward, plummeting from 170 to 120 to 90 in the space of a breath. The blood pressure reading dipped to 30 over unmeasurable, then flashed low, then went blank. Rhythm is worsening, Priya snapped. We are losing perfusion. On the screen, the sharp complexes of tachycardia broke apart, becoming irregular waves, then small chaotic undulations. PEA, Cole said. We have pulseless electrical activity. Start compressions again. This time, we might not get him back so easily. Maya took one last look at Jamal's face, then moved into position at his chest. The edge she had been balancing on crumbled a little more under her feet as she placed her hands and began to push. Maya counted under her breath as she pushed. 1, 2, 3, 4. Jamal's chest compressed under her palms, then rose back the recoil just enough to keep the blood moving. Each downward press drove a faint whoosh of air out of his lungs through the tube. The ventilator paused, letting her work, then hissed again in between sets. The monitor traced a line that no longer matched her efforts. Narrow, weak complexes marched across the screen without conviction. Check a pulse, Cole said after the fourth round. Maya stopped. Priya's fingers went to Jamal's neck, pressing with just the right amount of pressure. Her brow drew together. I cannot feel one, she said. Try the femoral, Cole said. She lifted the sheet, reached toward Jamal's groin. Nothing, she said quietly. Cole looked at the monitor. The electrical activity still flickered, a mocking echo of life. Continue compressions, he said. He said. Maya set her jaw and started again. The smell in the room had shifted. Fresh blood and sweat and the faint singe of defibrillator pads from earlier hung in the air. Her own muscles screamed in protest, but she clung to the rhythm. Around her, the team moved with a grim, practiced choreography. Epi given 3 minutes ago, a nurse said. Give another, Cole replied. Mag is in. Yes. How long have we been running this code? He asked, without looking away from Jamal. 22 minutes since first loss of pulse, Priya answered. 22 minutes. Maya felt each second in her shoulders in the slow burn from her wrists to her elbows. Sweat dripped down her spine. Her breaths came fast. She did not let herself slow her hands. She had seen codes stretch longer. She had seen them end faster. The length did not always match the outcome. What mattered was what remained inside the body, what reserves it had left. She thought of Jamal's mother on the phone, the way her voice had cracked on the word baby. Baby. The boy on the table was tall, all limbs and long fingers, but right now he felt too small under Maya's hands. Switch, Cole said. The tech stepped back in. Maya moved aside, flexing her numb fingers. Her chest heaved. Priya checked the monitor again. PEA is degrading, she said. The complexes are getting smaller. The green line had turned into tiny bumps on a near-flat baseline. The heart was sending out weak electrical sparks that went nowhere. Cole's eyes went to the clock, then to Jamal's face. Any reversible causes we have not addressed, he asked. The resident spoke up, voice unsteady. Hypovolemia for sure. We are treating with blood and fluids. Hypoxia, we are ventilating. Hydrogen ion, his last gas, showed acidosis, we gave bicarb. No obvious tension pneumo, no cardiac tamponade on ultrasound. Priya nodded. This is all hemorrhagic shock, she said. The source is the abdomen. The cause is right there. We cannot fix it without a knife. They all knew it. The problem lay a few centimeters under their hands, behind muscle and bowel and torn vessels hidden by skin and protocol, and a locked OR door. Another epi, Cole said. Then we reassess. The nurse pushed the drug. The tech kept up compressions. The ventilator continued its mechanical sighs. Maya pressed the back of her wrist against her forehead, smearing sweat. She stared at Jamal's abdomen. The rise from earlier had flattened somewhat under the relentless compressions, but it was still distended, tense as a drum. Her mind slipped not away but sideways. The harsh hospital lights became the yellow glare of generator bulbs. The hum of the ventilator turned into the roar of a diesel engine idling too close. The cold air of the trauma bay warmed into heavy heat that smelled like dust and something burning. She stood again in a white tent, canvas walls stained at the corners, sand grinding under her boots. The table in front of her was a plank laid across crates. Another young man lay on it, skin the same gray-yellow that Jamal was turning eyes half open. Arabic voices overlapped the words urgent and tangled, but fear sounded the same in any language. A man with a shaved head and a beard streaked with white stood at her elbow. His hands moved quickly, improvising where instruments were missing, using clamps that had been sterilized too many times. Here, he said in accented English, guiding her hand. Feel that. That is the artery. You keep pressure right there. You cannot see it, but you can feel it. If you let go, he dies before we get him out of here. Her fingers had sunk into warmth and slickness, searching for the hard, pulsing rope inside the chaos. When she had found it and pressed, the gush had slowed. The man's breath had steadied for a while. Hours later, in a different tent, near a different road, she had tried the same thing on a boy who had been hit by shrapnel. That time when she pressed, there had been nothing to feel but torn edges and emptiness. He had died with her hand still inside his body. The memory of his weight, his mother's wail somewhere outside, folded over the scene in front of her like a double exposure. Reyes. Cole's voice cut through the haze. She blinked. The tent dissolved. St. Gabriel's trauma base slammed back into focus. "Check a rhythm," he said. The tech stopped compressions. All eyes went to the monitor. The line flattened. No tiny bumps, no electrical noise, just a straight green trace marching across a dark screen. "Asystole," Priya said. Silence fell like a heavy blanket. Even the ventilator seemed too loud. Cole's shoulders dropped a fraction of an inch. He looked at the clock again. The second hand moved with brutal precision. "Check for a pulse," he said, even though they all knew. Priya's fingers pressed Jamal's neck. She stayed there a little longer than usual. "Nothing," she said softly. The tech checked the femoral again, more from ritual than hope. "Nothing," he confirmed. The code had shifted. They were no longer wrestling with a heart that refused to work. They were now facing the absence of a heartbeat altogether. "Time of last epi?" Cole asked. 2 minutes ago, the nurse replied. "We will run 2 more cycles," Cole said, "then we reassess." Maya felt a thickness in her throat. There was protocol even for endings. Times and doses, and how long you tried before you were allowed to stop. She moved back into position without waiting to be told. Her hands found the same spot on Jamal's sternum as if molded there. "Begin compressions," Cole said. She started again. The flat line on the monitor did not waver. The machine did not protest. It simply drew the absence in a quiet, relentless sweep. Her arms ached almost immediately, fatigue layered over fatigue. She pushed through it. Her thoughts scattered, then narrowed. There was only the weight under her palms, the count in her head, and the sense that something was slipping away with each pass of the second hand. "Switch," Priya said after a while. This time Maya did not argue. The edges of her vision had started to dim. She stepped aside and grabbed the bed rail with one hand to steady herself. The tech took over, chest pressing under his palms. The scene looked like it always did near the end. Movements still precise, but with a heaviness behind them. Cole looked around the room. "Anyone have anything else to offer?" he asked. "Any reversible cause we have missed?" No one spoke. The resident stared at his shoes. The nurses adjusted bags and checked lines, but nothing new appeared in anyone's eyes. Maya leaned back against the wall for a second, the cool surface grounding. In her ears she heard overlap. The quiet of this room. The distant roll of artillery from a memory. The click of a mother's tongue on a phone line as she begged a stranger not to let her son die. Her own breath. The absence of Jamal's. "Reassess rhythm," Cole said. The tech stopped compressions on cue. The flat green line did not change. Priya checked for a pulse one last time. Her fingers moved from neck to groin, then to the wrist that Maya had held so tightly before. She shook her head. Cole took a slow breath and let it out, shoulders rising and falling. "Call it," he said quietly. Priya looked at the clock. "Time of death 1946, she said. She said. The words did something to the air. They made the silence heavier, more permanent. The tech stepped back from the bed. The nurse switched off the defibrillator. Someone turned the ventilator down to a soft, useless whisper, then off. The tube stayed in Jamal's mouth, but he no longer rose and fell with the machine. Maya's throat closed. Her chest felt too tight, as if someone had wrapped a band around it. She moved away from the wall and toward the bed. Her feet felt strangely distant from the floor, like she was walking underwater. Jamal's face was still. His lashes shadowed his cheeks. The small jersey on his chain had turned the etched number, catching a bit of light. In the doorway, Alton stood with another nurse. Their postures held the familiar mix of compassion and distance that came from seeing this scene too many times. "Family is here," he said. Here, he said softly. Of course they were. Maya thought of the woman's voice on the phone, the way it had said the word pizza, with such bewilderment and hurt. He was just getting pizza. Her stomach twisted. Cole stripped off his gloves slowly, like each finger needed to be freed one at a time. His hands were pale where the gloves had gripped his skin. "I will talk to them," he said. "Give me a moment." He stepped back from the bed and turned away, pressing his thumb and forefinger into the bridge of his nose for a second before he composed himself. Technicians began the small rituals of after, turning off machines, gathering wrappers and used gauze, straightening the sheet over Jamal's body. Maya stared at the movement, her hands hanging useless at her sides. Her skin still buzzed with adrenaline. Her body had not gotten the message that the fight was supposed to be over. She took a step closer to the bed. The sheet had been pulled up to Jamal's chest. His arm lay on top of it, palm up, fingers slightly curled. The bruises from IV attempts mottled his forearm. Her gaze dropped to his abdomen. The wound was partially covered, the gauze packed thick, the skin around it discolored and swollen. Beneath that surface somewhere the artery had torn. Blood had poured and poured until there was simply not enough left in the rest of him. Her mind refused to accept that this was all that could be done. Her fingertips tingled. She could almost feel through glove and skin and air the place where pressure might have made a difference. The place where in another life, under another set of lights, she had found a pulsing rope and squeezed until help arrived. If she had acted earlier, if she had insisted harder, if, the word looped in her head small and vicious. Behind her she heard Cole's footsteps head toward the door. She heard Priya exhale long and tired. She heard Altan murmur something about prepping a room for family viewing. Maya did not move. She looked at Jamal's still chest at the flat line on the monitor that no one had turned off yet. Something inside her, something that had been bent into shape by heat and dust and bad lighting, and worse, odds straightened. Her heart hit her ribs hard enough to hurt. The thought came clear and sharp. Not yet. Maya's body moved before her mind caught up. Cole took a step toward the door. His shoulders had that set she had seen on other doctors, the one that said the worst part of the job was about to begin. Priya turned toward the ultrasound cart, already thinking about the next case that would roll in. "Wait," Maya said. It came out too loud. Heads turned. Cole paused. The room, which had just begun to relax into the heavy rhythm of aftermath, tightened again. Maya heard her own pulse in her ears. She felt the room tilt around her just a fraction like an elevator starting down. "Reyes," Cole said, "you should take a break. Hydrate. This was a hard code." He meant it. He sounded tired in a way she had not heard earlier. She shook her head. "No," she said, wait, on calling it." Priya blinked. "We already called it," Priya said. "Time of death has been recorded. There is no electrical activity, no pulse." She said it gently, as if explaining something to a family member, not another clinician. Maya stepped closer to the bed. The monitor still showed that flat green line. The numbers were blank. "He is gone, Reyes," Cole said. "We did what we could." The words hit her like sand in her teeth. "We have not done everything," she said. Her voice was steady now. It surprised her. Cole's jaw worked. "There are lines," he said. "We follow them for a reason. We do not torture dead bodies in the hope that something will change." The phrase dead body slid under her skin like a knife. She looked at Jamal. His face was still, but his skin still held that faint warmth that bodies kept for a while. He did not look like a corpse yet. He looked like a boy who had fallen asleep in the middle of an argument. Behind the glass, she could see shapes moving in the waiting area. A woman being guided to a chair, another nurse bringing tissues. The family was here. Time was moving. Maya heard her own thought again clearer. Not yet. She turned back to Cole. "I am not talking about torturing him," she said. "I am asking you to let me try something I know how to do once, for seconds. If it does nothing, then you can tell his mother he died at 1946, and that will be the truth. If it works even for a moment, it buys you the chance to get him upstairs alive." Cole studied her face. There was a faint smear of blood along her cheekbone that she had not noticed. Her hair had come loose from its tie. Her eyes were bright with something that was not denial, not exactly. "Reyes," Priya said quietly, "you are asking to perform an invasive procedure that is not in your training on a patient who has been declared dead without imaging, without backup, without consent." The list sounded damning when she laid it out like that. Maya swallowed. "You want my training documented," she said. "Fine. I worked in a conflict zone with a team that had to improvise every day to keep people alive until we could get them out. I have done this before. I know the landmarks. I know what it feels like when it is right and when it is wrong." She pointed to Jamal's abdomen. "He's not 3 hours from help," she said. "He is 1 floor. That is the difference." Silence stretched. Alton shifted in the doorway, uncertainty in his eyes. The techs looked anywhere but at the bed. The resident who had fumbled compressions earlier stared at the floor, ears reddening. Cole's gaze went from Maya to Jamal to the glass where the family shapes moved, then back again. "You want me to sign off on you reaching into his abdomen and clamping his aorta blind," he said, "after we have called the code. You understand how that sounds? Yes. It sounds like the only thing we have not tried," she replied. "And I am the only one in this room who has done it." Priya bristled. "Field tricks are not documented standard of care," she said. "If anything goes wrong, if his family finds out we let a nurse put a hand inside their son's belly after he died, they will own this hospital. They are going to bury their son either way if we stand here and talk," Maya said. The words were out before she could soften them. They hung there harsh and undeniable. The clock over the door ticked. Cole exhaled through his nose. The hard set of his shoulders shifted a fraction. "How long would it take?" he asked. Maya's heart jumped. "Less than a minute to position," she said. "Another minute to see if it changes anything." 2 minutes, he said. He looked at the monitor again at the flat trace. He looked at Jamal's chest no longer rising on its own. We have already passed the usual cutoff for resuscitation, Priya reminded him. Prolonging this is not going to bring his brain back if it has already gone. Her voice had softened too, fatigue threaded through it. Maya thought of the faint flutter she had once felt in a boy's neck after they squeezed his artery and held it for what had felt like hours. The way his eyes had opened on a helicopter later. You asked if anyone had anything else to offer, she said to Cole. I do, but I need you to allow it. It was a direct challenge. It came out without anger, just a simple statement. Cole's eyes narrowed not in hostility, but in thought. He was a man who prided himself on rational decisions. Right now, rationality was standing on a very small rock in a rising flood. He dragged a hand over his face. This is insane, he said. He said. Maya did not disagree. He looked at Priya. Medically, he said the boy is dead, legal time of death has been called. Anything we do now is outside usual protocol. Exactly, she said. Which means, he continued, we have room to attempt something that is not in the book because the book has already brought us here. Priya stared at him. You cannot be serious, she said. You said it yourself, he replied. Our only problem is hemorrhage we cannot reach. Reyes thinks she can reach it. If she is wrong, we have lost nothing we did not already lose. If she is right, we gain a patient with a pulse upstairs. He paused. 2 minutes, he said to Maya, no more. The room seemed to tilt again. Relief and terror hit her in the same wave. Yes, doctor, she said. Priya blew out a breath. I want it on record that I advise against this, she said. But if we are doing it, we do it with some control. Ultrasound guidance as much as possible. I will watch for changes. Her compromise came with sharp edges, but it was still a compromise. Cole nodded. Everyone else, he said, raising his voice slightly, if you are not essential to this step out, we keep this team tight. Alton took the hint, herding the extra nurse and tech toward the door. The resident hovered. Doctor, should I stay, he asked. Cole weighed him, then shook his head. Go help with the family, he said. They will need someone to sit with them. The resident looked almost relieved as he slipped out. The room shrank. It was now just Cole, Priya, Maya, one nurse at the medication cart, and one tech by the monitor. Maya moved to Jamal's right side. The sheet over his abdomen was still in place. Her hands felt suddenly too big and too clumsy. Cole stood opposite her. Talk me through exactly what you plan to do, he said, step by step. She nodded. I am going to extend the existing opening in his abdominal wall just enough to insert my hand, she said. Then I will sweep along the posterior aspect, feeling for the aorta just above its bifurcation. Once I find it, I will apply pressure interiorly with gauze, and if needed, a narrow clamp to pin it against the spine. That should reduce distal flow and slow bleeding from any torn branches below. She kept her voice calm. The words came easily. She had said them once before in a tent under different lights. Priya turned the ultrasound machine back toward the bed. I will keep a probe in the upper quadrants, she said. If you actually occlude the aorta, I should see changes in the flow patterns. Cole grabbed a sterile instrument tray, flipping it open. The metal glinted. We will not have a full sterile field, he said. Risk of infection is academic at this point. He handed her a fresh pair of sterile gloves and a small curved clamp with a narrow tip. This is the best match we have in the room, he said. Maya stripped off her old gloves and scrubbed her hands quickly with sanitizer. She waited just long enough for them to feel dry, then pulled on the sterile pair. The familiar snap at her wrist felt louder than it should. Her breath slowed. She picked up the clamp. It sat in her palm like something heavier than steel. Priya repositioned the probe cold gel shining on Jamal's upper abdomen. Ready, Priya said. Her voice had lost its earlier edge, replaced by a focused intensity. Maya folded back the sheet. The wound gaped up at her. The earlier packing had soaked through. She gently removed a few layers of gauze, exposing muscle and fat and dark pooled blood. The smell of iron rose stronger. Last chance to back out, Cole said softly. His tone was not mocking. If anything, it sounded almost protective. Maya shook her head. I am in, she said. She slid her left hand into the wound fingers closing around the clamp. Her right hand rested on Jamal's flank for leverage. The heat inside his abdomen contrasted with the cool air of the trauma bay. It was thick warmth, slick and resistant. Her fingers sank through layers of tissue that did not belong to Chicago, not really, but the map under them was the same as it had been thousands of miles away. She moved slowly, advancing along the back wall of the cavity, searching for something that felt like a firm pulsing tube. Talk to me, Cole said quietly, eyes on her face. Passing the peritoneal layer, she said. Too much free fluid, harder to distinguish structures. Her fingertips brushed something soft, and loops of bowel slipped away from her touch. She adjusted angle and depth. The clamp's tip clicked softly against something harder, maybe vertebral bone, maybe the posterior wall. Nothing yet, she said. Priya watched the ultrasound eyes flicking between the screen and Maya's hand. His aorta is there, Priya murmured, tapping a shadow on the black and white image. You should be just anterior to it. Maya closed her eyes for a second, not to block anyone out, but to feel better. The tent came back, the voice at her ear, the man's words. Here, feel that. She inhaled slowly, then exhaled through her nose. Her fingers adjusted, sliding a little more to the left, then pressing gently downward. There. A firm tubular structure pushed back against her fingertips. Not pulsating now, not like it had in the tent, but with a density different from the surrounding tissue. I think I have it, she said. Her voice came out low. Cole's gaze sharpened. Are you sure? He asked. As sure as I can be, she replied. She opened the clamp slightly, maneuvering its narrow jaws around the structure and the folded gauze she had brought in with her fingers. She pressed the bundle gently but firmly toward what she imagined was the spine, pressure steady and unrelenting. Her forearm trembled with the effort. Priya's eyes were glued to the screen. Let me see, Priya murmured. For a moment, nothing changed. The ultrasound showed the same swirling gray. The monitor over the bed still displayed a straight green line indifferent to everything happening under the skin. Sweat broke out along Maya's brow. She tightened her grip, holding the imagined artery against the hardness beneath it. Her world shrank to the warmth around her hand, the clamp in her fingers, and the stubborn thought that had driven her to this point. Not yet. For a few heartbeats, nothing in the room changed. The monitor above Jamal's bed kept drawing its flat green line. The ventilator sat quiet. The overhead clock ticked. Maya held the clamp in the wad of gauze in a steady grip, fingers deep inside the heat of Jamal's abdomen. The muscles in her forearm burned. Sweat slid along her spine. Anything, Cole. Cole add tips. Priya narrowed her eyes at the ultrasound screen. Hold it right there, she said. Do not move. Her voice had lost the earlier edge. It sounded intent. Maya froze. Every part of her body went still except the hand inside Jamal pressing down. On the screen, gray shapes floated in a sea of darker gray. Priya adjusted the depth, then flipped on color flow. Blue and red streaks lit up faint at first. There, she murmured. Flow in the aorta is reduced. Distal branches look sluggish. Her eyes widened a fraction. You are actually occluding it, she said. Cole leaned closer, peering at the image, then at Maya's hand, then at Jamal's belly as if he might see through it. That should reduce bleeding in the pelvis and lower abdomen, Priya continued, if there is any blood left to push. Maya's fingers trembled from effort. She tightened her grip around the clamp, locking her wrist. Somebody start compressions again, Cole said suddenly. If distal bleed is reduced, we might get better central perfusion. The tech moved back into position, palms over Jamal's sternum. On your count, Reyes, Cole said. Maya swallowed. Go, she said. The tech began compressions. Jamal's chest rose and fell under the force. Each push sent a wave of pressure down the aorta that Maya could feel against her fingertips, a faint surge pushing back against her clamp. The sensation was strange, like bracing a hose that someone had just turned back on, but only halfway. Keep that angle, Priya said. Do not lose that pressure. I'm not letting go, Maya said through her teeth. The tech counted aloud this time. 1, 2, 3, 4. The room narrowed to rhythm. Press recoil, press recoil. The clamp in Maya's hand dug into her skin. Her biceps shook. Check the monitor, Cole said. For long seconds, the green line stayed flat. Then a small bump appeared. Just one. It rose barely above the baseline, then fell again. Was that artifact? The tech asked, breathless from compressions. Keep going, Coles said. Another set of compressions, another pause, another look at the screen. A second bump appeared, this one a little taller. Then a third. The flat line began to break up into small, irregular complexes. That is electrical activity, Priya said, not just noise. Her voice rose just enough to make Cole's head snap back toward the monitor. Stop compressions, Cole ordered. Everyone else hands off. Let the machine see what it wants to do. The tech lifted his hands. The bed stilled. The room held its breath. On the monitor, a shaky rhythm formed. The complexes were wide and slow, but they were there, marching across the screen with a stubborn, uneven cadence. Idioventricular rhythm, Priya whispered, slow but present. Check for a pulse, Cole said. Priya went to Jamal's neck. Her fingertips pressed against the carotid. She stayed there long enough for doubt to creep in. Then her face changed. I have something, she said, faint, but it is there. Femoral, Cole said. She moved her hand down, fingers pressing into the crease at Jamal's groin. The sheet was damp under her touch. It is stronger here, she said. You are blocking above. He is perfusing proximal. Cole let out a breath that sounded almost like a laugh. Of course he is, he said. He looked at Maya. Keep holding exactly where you are, he said. Do not change a thing. Her arms burned. A tremor ran from her shoulder down to her fingertips, but she nodded. BP, Cole called. The nurse at the monitor squinted at the numbers as they flickered back to life. 42/20, she said. Heart rate 35 and climbing. SAT is coming up off the floor. It is not much, Priya said, eyes still on the ultrasound, but it is better than nothing. Better than a flatline, Cole replied. The ventilator was turned back on. Air hissed through the tube in Jamal's throat, his chest rising with each mechanical breath. Maya fixed her eyes on the boy's face. His lashes rested against his cheeks. There was no sign behind them that he was aware of anything, but his skin still held more warmth than it had a few minutes before. A drop of sweat rolled from Maya's temple down to the corner of her mouth. It tasted like salt and sanitizer. Her muscles screamed for rest, but her grip did not loosen. Heart rate 50, the nurse reported. Pressure 55/30. It is creeping. Call the OR, Cole said, voice suddenly sharp again. Tell them he has a pulse and we are coming now. They can finish closing the aneurysm with him in the room if they have to. The circulating nurse grabbed the phone. Trauma 1-2 Orcule, she said. We have return of spontaneous circulation. We need a room now. We are bringing the patient up with manual aortic control. There was a squawk on the other end, then a flurry of rapid words. She repeated them back. They say OR2 is being turned over, she said. They can be ready in 5 minutes. They have 2, Keo, Cole said. We are not letting this bleed start again down here. He looked at Maya. Reyes, can you hold that pressure through transport? He asked. Her arms felt as if they were carved from lead. The idea of walking while maintaining this exact angle made her stomach flip. But she knew the answer before the question finished leaving his mouth. Yes, she said. You lose that occlusion, he tanks, Priya said quietly. It was not an accusation, just a fact. I will not lose it, Maya said. Her shoulder twitched. She adjusted her stance, spreading her feet wider, locking her elbow to brace against the bed rail. Cole turned to the tech. Get transport monitors, he's of do, Naomi said. Call elevator priority, clear a path from here to OR2. I want no delays. The tech ran to obey. The nurse began disconnecting the larger monitors and preparing portable equivalents. Tubing was checked, lines secured, bags of blood and pressors hung on hooks that would travel with the bed. Maya could not help with any of it. Every bit of her focus was wrapped around the feel of the clamp and the imagined artery under her hand. She became aware of her breathing slow and deliberate, matching each inhale with a mental count. 1, 2, 3. Heart rate 60, the nurse called. Be 60/35. It is holding. That is enough to buy us a chance, Cole said. Not much more, but enough. He stepped closer to Maya, lowering his voice. If at any point your hand slips, he said, tell me immediately. We will adjust or stop and reposition. Do not pretend you can hold if you cannot. There was no criticism in his tone, only concern. She met his eyes. You will know before I say it, she said. His numbers will tell on me. A corner of his mouth twitched, not a smile exactly, something like respect. Priya moved to the head of the bed, checking the endotracheal tube, making sure it was secure for the ride. She smoothed a piece of tape, then glanced down at Maya's buried forearm. What does it feel like? Priya asked. Maya did not look up. Like leaning on a hose, she said. You can feel the push every time the heart tries. It is faint, but it is there. Priya nodded slowly. Ultrasound flow patterns match what she's describing, she said to Cole. Proximal flow is present, distal is reduced. It is not a perfect clamp, but it is effective. Perfect is the enemy of done, Cole said. We take effective. The tech rolled in a portable monitor and clipped new leads onto Jamal's chest. The familiar beeps resumed, quieter but still insistent. Oxygen saturation climbed from the 50s to the low 60s, then into the 70s. The numbers were ugly. They were also better than zero. Alton appeared at the door again. The family is asking for an update, Wisemem, he said. Do you want me to tell them he is gone or that he is going upstairs? The question hung in the air. Cole glanced toward the glass where a woman sat hunched in a chair, hands clamped around a hospital-issued tissue, another relative's arm around her shoulders. Even at this distance, grief radiated off her like heat. Tell them he lost his pulse, but we got it back, Cole said. Tell them he is critical and we are taking him to surgery right now, no promises. Alton nodded. I can handle that, he said, then disappeared down the hall. The elevator chime sounded faintly beyond the double doors. Transport ready, tech buddy, the tech said. Elevator is waiting. All right, Cole said. He took a breath and let it out slowly. On my count, we move. Reyes, you stay where you are. We will adjust the bed and the drapes around you. The team gathered around the gurney, each person taking a position. Lines were lifted. The ventilator was switched to a portable unit with a soft hiss. The sheet over Jamal's legs was tucked in tighter. Maya's world shrank even further. She imagined her arm fused to Jamal's side, her hand part of the equipment. 3, 2, 1, Cole said. They unlocked the brakes. The bed jerked slightly, then began to roll. The movement sent a shift through the tissues around Maya's wrist. The clamp pressed harder into her palm. She adjusted, keeping the pressure steady. How are you? Cole asked, walking beside her, one hand on the bed rail. Still on it, she said. Her voice sounded strange, like it was coming from somewhere else. Heart rate 65, the nurse reported from the head of the bed. Pressure 65/40, holding. The trauma bay lights passed overhead in bright strips. The hall opened before them, cleared of other stretchers, nurses pressing themselves against the walls to let them through. They turned a corner. The movement twisted Maya's shoulder. Pain shot down her arm. She bit the inside of her cheek and tightened her grip. The elevator doors were propped open. The car waited empty, buzzing with fluorescent light. Slow, Cole said. Do not jar him. The bed rolled in. There was barely room for everyone. The nurse with the monitor squeezed into one corner. Priya stood at the head. Cole planted himself near Maya. The door slid shut. For a moment, the tiny space felt too full. The air smelled like sweat and the faint metallic tang of blood. Maya focused on the clamp, the artery, the steady, tiny push of pressure that told her Jamal's heart was still trying. The elevator lurched as it began to rise. The floor dropped a fraction under Maya's feet, then steadied. Heart rate 70, the nurse said. BP 70/42. The numbers were still whispered, still fragile, but they were moving in the right direction. Maya let herself close her eyes for 1 second, only long enough to inhale and exhale on purpose. Then the elevator chimed and the door slid open to a different light, a different hallway, the sign above reading operating rooms in block letters. They rolled forward. Maya moved with the bed, her arm still buried to the wrist, hand clamped around the one thing holding Jamal between a pulse and the line she refused to accept. The operating corridor felt colder than the ER. The floor was a different shade of tile, glossy and spotless. The air smelled stronger of antiseptic and something chemical that clung to the back of the throat. The noise was different too, fewer voices, more machinery, a lower hum of contained urgency. Or two, Cole said, pointing. The team steered the bed through the open doors. Bright lights exploded overhead as they rolled into the room. Stainless steel surfaces flashed. A cluster of masked faces turned toward them. A scrub nurse in blue stood by the instrument table, hands folded on her chest in sterile readiness. A tall surgeon in a gown and cap, his mask already on, stepped forward. His eyes were pale behind clear shields. Adrian Bauchi, he said to Cole. This must be your miracle. This is Jamal Carter, Cole replied. Single abdominal gunshot, massive intra-abdominal hemorrhage. Coded in the ER. We lost and regained pulses. Nurse Reyes is manually occluding his aorta. He said it cleanly, no decoration, but the words still made the surgeon's brows shoot up. Manually, the surgeon repeated, looking at Maya's arm. She stood pressed against the bed, her left hand still inside Jamal's abdomen, her right braced on the mattress to keep her position. Her shoulder ached so deeply it had become something distant. The surgeon glanced at Priya. Is that actually working? He asked. Priya wheeled in the portable ultrasound, wiping fresh gel onto Jamal's upper abdomen. We saw reduced distal flow when she clamped, she said. Proximal perfusion improved enough to get a pulse. The anesthesiologist at the head of the bed checked the ventilator settings and confirmed breath sounds with a quick sweep of his stethoscope. Vitals now, Cole asked. The circulating nurse read off the monitor. Heart rate 72, she said. Blood pressure 70/45, sat 79 and climbing. The numbers were still tenuous, but to an OR team ready for zero, they were a gift. The surgeon nodded once. All right, he said. Let us not waste whatever you bought us. He moved to the sink, scrubbed his hands in a flurry of efficient motions, and came back to the sterile field. The scrub nurse helped him into his gown and gloves. He approached the table, eyes on Maya. Name is Agu. He asked her. Maya Reyes, she said. Her voice sounded hoarse to her own ears. You still have the aorta compressed, he asked. Yes, she said, just above the bifurcation. He nodded. When I tell you, I will need you to ease off slowly so I can see where we are bleeding, he said. Until then, do not move. Her muscles screamed at the idea of until then, but she nodded. I'm not going anywhere, she said. He turned to his team. Midline laparotomy, he said, fast and clean. The scrub nurse slapped a scalpel into his hand. The circulating nurse announced the start time for the chart. Maya had to lean slightly away as the surgeon extended the existing wound into a formal incision, cutting upward and downward in one smooth motion. The skin parted under the blade. A thin line of fresh blood appeared, then more as subcutaneous tissue followed. He worked quickly, opening the fascia and muscle with practiced strokes until the abdominal cavity lay exposed in a way that made Maya's previous improvised access look small. Blood pooled inside dark and glossy under the lights. It looked almost black. "That is a lot," the assistant surgeon muttered. "Suction," the lead surgeon said calmly. 2 suctions plunged in their tips, slurping up the pooled blood. The OR filled with the wet hiss and gurgle. The reservoirs beside the machine filled steadily. "Can you feel her clamp?" the assistant asked, peering into the cavity. The lead surgeon palpated deeper. "I feel the aorta compressed against the spine," he said. "Reyes, you have good hands." The praise barely registered. Maya focused on holding exactly the same angle, the same force. "On my count," the surgeon said, eyes on the field. "You will slowly reduce your pressure, not all at once." Her throat felt dry. "Ready," she said. 3, 2, 1, he said. "Start releasing." She loosened the clamp by degrees, easing up on the pressure, feeling for the change in the vessel under her fingertips. As she did, fresh blood welled up in a sudden jet from deep in the pelvis. A bright arc against the darker pool. "There you are," the surgeon said. He followed the spray with his hand, clamping down with a vascular clamp at the source. "Suction here," he ordered. "Iliac branch maybe. Hold that." He adjusted his instruments. "Reyes, you can let go now," he said. "I have the vessel." The words did not quite land at first. They had to thread their way through the fog of effort in her muscles. "You have it," she repeated. "I have it," he confirmed. "Back away slowly. Do not contaminate the field. Someone support her. She has been standing like that for how long now?" Maya felt hands at her elbow guiding her as she gently slid her forearm back out of Jamal's abdomen. The clamp came last, its tip slick. The air of the OR hit her skin cool against the heat that still clung to her. Her arm shook uncontrolled. She kept the clamp away from the sterile field as a tech took it from her. When her hand finally emerged, it was blood-soaked up to the mid-forearm glove, red and shiny. The sterile cuff had torn somewhere during the process. Blood had seeped under, streaking her wrist, and the white crescent scar there. "Here," Priya said. She stepped in with a sterile towel, wrapping it around Maya's arm, then guiding her backward away from the table. "Do not faint in here," Priya said under her breath. "You will hit your head on something sharp." There was dry humor in it and something else. Worry. "I'm not going to faint," Maya said. Her knees felt strange, but they held. She backed against the wall, slid down until she was sitting on a low stool. Her arm rested on her lap, wrapped in towel. Her heart hammered in her throat. From across the room, she watched the real surgery begin. The lead surgeon clamped tied cut. He and his assistant worked in a coordinated rhythm, reinforcing what Maya had started with proper exposure and instruments. Suction cleared the field. More vascular clamps appeared and disappeared. The anesthesiologist called out occasional updates. "Heart rate 85, he said. "Pressure 80/50, oxygen 88 and climbing." "Good," the surgeon replied. "He is responding." Cole stood near the foot of the table gown, ungloved but mostly observing. He watched the numbers as if they were lines in a book he was rereading for the first time. He glanced over at Maya. She looked smaller from where he stood, shoulders slumped, dark hair escaping her cap, eyes fixed on the boy on the table. The towel on her lap was already stained through. He stepped toward her, stopping just inside the boundary between clean and not. "You can take those gloves off now," he said. She looked down at her hands as if noticing the gloves for the first time. "Right," she said. She peeled them off slowly. Her skin underneath was wrinkled and pale. Blood had seeped under the torn cuff, drying in lines around the scar on her wrist. Cole nodded toward the sink. "Wash," he said. "Then drink water, sit, breathe." It came out like an order, but the tone was softer than usual. Maya obeyed. She walked to the scrub sink, turned on the water. Pink foam and red streaks swirled down the drain as she scrubbed. The water ran hot enough to sting. Her muscles protested every movement. The adrenaline that had kept her standing began to ebb, leaving a heaviness behind. She caught her reflection in the small stainless panel above the sink. Pale face smudged with something dark along one cheek. Eyes too bright. She barely recognized herself for a second. She cupped water in her hands and splashed her face, then grabbed a paper towel. When she turned back to the room, Priya was standing a little apart from the table, watching the surgeon tie off another vessel. She looked over at Maya. Their eyes met. For a moment, neither spoke. Then Priya stepped closer. "Your landmarks were correct," she said. "Textbook was jealous." There was an attempt at a smile behind her mask. Maya let out a breath that pulled something tight in her chest. "It helped," she said. "You with the ultrasound." Priya glanced at the machine. "It was like watching a river get a dam," she said, "in real time." She hesitated. "You really learned that in a tent?" she asked. "Different tents," Maya said. "Different days." Priya studied her for a second. "I'm sorry I dismissed you," she said quietly. "Back downstairs." The words were simple. They carried more weight than their length. Maya shrugged, then winced as the movement tugged at tired muscles. "We are all trained to trust the book," Maya said. You are not wrong to do that. Not trusting you was the part that was wrong, Priya said. She looked back at the table. You gave him a chance to get here, she added. Maya did not have an answer to that, so she nodded once. The surgeon's voice cut through the softer conversation. Major bleeding is under control, he said. Iliac branch ligated. We are checking for secondary sources. The anesthesiologist responded. Vitals stable, he said. Heart rate 90, pressure 90/60, sat 92. The number sounded almost normal spoken out loud, even if the context around them was anything but. Cole exhaled just once slowly. Keep him there, he said to the room at large, though he knew it was not that simple. The scrub nurse handed another instrument. The bright lights reflected in the metal in the pool of clear irrigation fluid that replaced the dark blood in the cavity. From her seat against the wall, Maya watched Jamal's chest rise and fall under the sterile drapes. Only a small rectangle of his skin showed through the surgical window, now the rest of him hidden under blue. It felt unreal that only an hour earlier she had been in the ER thinking about coffee and snow and the sound of monitors. That version of the night had been replaced by this one layer by layer like gauze, soaked through and discarded. Her arm throbbed in time with her heartbeat. Her fingers still remembered the shape of the vessel under them. She flexed her hands slowly, testing each tendon. Cole walked over to her again. You holding up? He asked. Getting there, she said. He studied her face for a moment. What you did, he said, choosing each word with care, was beyond anything I have ever seen in that trauma bay. She looked away, the compliment sitting awkwardly on her shoulders. I did what I knew how to do, she said. You let me. His mouth tightened, not in disapproval, but in recognition. I almost did not, he said. That will sit with me for a while. They both looked back at the table where the surgeon worked at the boy whose life had become a junction point for their choices. The OR lights hummed. Instruments clinked softly. The monitor kept time with a regular, insistent beep. For the first time since Jamal had rolled through the ER doors, the sound no longer felt like a countdown. It sounded like something that could be followed instead of outrun. Snow melted slower in the city than it came. By the time the sun rose 2 mornings after Jamal's surgery, the plows had carved gray corridors through the drifts. Piles of dirty ice sat at every corner. The hospital parking lot glistened in patches where salt had lost its fight. Inside St. Gabriel, the light looked softer. The worst of the storm had passed. The ER was still busy, but the edges of desperation had worn down a little. On the surgical ICU machines did most of the talking. Jamal lay in a bed near the window, the blinds half open. The skyline of Chicago was a blur beyond them, more suggestion than view. He was less wires than he had been in the OR, but still more plastic than person. The ventilator hissed, then paused, hissed again. The monitor over his head traced a steady green line with regular peaks. A clear bag of fluid dripped into one arm, a bag of blood thinner into the other. His abdomen was covered by a clean white dressing. A thick line of staples ran down the center when the nurses changed it, silver parentheses holding skin together. For now, the wound was hidden. Maya stood just outside the glass door, coffee cooling in her hand. She watched the nurse inside suction the tube adjust to drip smooth the blanket over Jamal's legs. His face looked different without the dried blood and stress. Younger. His hair had been washed, curls flattened against the pillow. A woman in a puffy winter coat occupied the chair by the bed. Jamal's mother. She held a paperback Bible in her lap thumb, marking a page she had not turned in a while. Her eyes stayed on her son's face, tracking every small movement. The ventilator had been turned down over the past day. Jamal's lungs had started to remember on their own. The plan was to try extubation this morning. Maya took a sip of coffee. It tasted burned. She swallowed anyway. Going in before... A voice asked behind her. She turned. Dr. Cole stood with his hands in the pockets of his white coat. His tie was crooked. He looked like he had slept, but not enough. Just watching for now, Maya said. He followed her gaze. Jamal's mother reached up and brushed a thumb across her son's cheekbone. Her hand was small compared to his face, fingers short and work rough. She has not left, Cole said. Not for more than an hour at a time. I'm not surprised, Maya said. He glanced at her coffee. That yours, he keyed. Ipsher, he asked. Technically, she said. It stopped being drinkable 30 minutes ago. He huffed a small breath that might have been amusement. Come in with me, he said. He should be waking more with the sedation off. If this goes well, we can take the tube out. She hesitated. Family might want just you, she said, the doctor who saved him. Cole's jaw ticked. You were the first line, he said. You should be there too. He did not wait for her answer. He pushed open the glass door with his shoulder and stepped in. The nurse looked up. We are ready when you are, she said. Cole nodded. Morning, Ms. Carter, he said gently. Jamal's mother looked up. Dark circles smudged her eyes. Doctor, she said, you come to tell me good or bad? Hopefully good, he said. We are going to try to wake him a little more and see if he can breathe on his own without the machine. Her fingers tightened around the Bible. He has been fighting that tube, she said. Even asleep, his face scrunches up like he does not like it. Most people do not, Cole said. If he does well, we will take it out. You can stay. Her eyes glistened. I am not going anywhere, she said. Maya stepped inside quietly, staying off to one side near the wall. The room felt warmer than the hallway filled with human breath instead of just recycled air. The nurse began to lighten the sedation drip, dialing it back slowly. She tilted the head of the bed up a few degrees so Jamal was at an angle, not flat. Jamal, she said, leaning close, we are going to wake you up a bit, okay? Try to breathe with the machine. His lashes fluttered. His hand moved under the blanket, fingers curling in. That is it, Cole said softly. Come on, kid. The ventilator hissed. The monitor beeped along. After a minute, Jamal's eyes opened to slits. The pupils were sluggish but responsive. He stared straight ahead, at first unfocused, then blinked. Jamal, Cole said. Can you look at me? Slowly, his gaze shifted toward the sound. It landed somewhere in the vicinity of Cole's shoulder, then corrected. Confusion clouded the dark irises. He tried to move his mouth. The tube blocked him. His brows drew together. I know, Cole said. It is uncomfortable. We have to make sure you can breathe by yourself first, then we will take it out. You are in the hospital. You were hurt. You had surgery. You are safe right now. Jamal's chest rose. The ventilator sensed his effort and delivered a breath. He coughed weakly around the tube. Let us see how he does, the nurse murmured. For the next couple of minutes, the room's focus narrowed. Every eye tracked the rise and fall of Jamal's chest, the waveforms on the ventilator screen, the oxygen saturation numbers creeping up and down within an acceptable range. He did better than expected. His breaths came regular if shallow, matching the machine's rhythm. I think he can handle it, the nurse said. Cole nodded. All right, he said. Jamal, listen to me. We are going to take the tube out now. When I say you cough and blow it out, okay? Jamal blinked slowly. It was not a clear yes, but there was awareness there. The nurse loosened the tape. Another nurse suctioned once more, clearing secretions. The ventilator was switched to standby. Ready, Cole said. On 3. He placed his fingers on the tube. 1, 2, 3, cough. Jamal gagged. Cole slid the tube free in one smooth motion. A string of saliva followed. Jamal coughed again, a ragged sound that scraped his throat, then sucked in a breath that was entirely his own. Oxygen via nasal cannula was in place almost immediately. The monitor watched his numbers, ready to complain if they dipped. For a few seconds, his breaths came in fast, panicked. His chest rose and fell as if he were underwater and had just broken the surface. Slow, Maya said quietly before she thought better of it. His eyes flickered toward her voice. She stepped closer, the coffee forgotten in her hand. Easy, she said. In through your nose, out through your mouth, like we practiced before. He frowned. Before, he croaked. His voice sounded like it had been dragged over gravel. The fact that he could form the word made something in her unclench. The ERs, she said. You probably do not remember much. That is okay. He took a breath the way she had suggested. It rattled a little, but it was slower. His mother stood now, one hand on the bed rail. Baby, she said, voice breaking. Jamal's gaze moved again, slower, this time settling on her. Ma, he whispered. The word was barely there, but it was shaped correctly. It carried recognition. His mother pressed her hand to her mouth, shoulders shaking. Hey, she said through tears, you scared me. He tried to smile. It came out lopsided. Pizza, he rasped. She let out a wet laugh. You are not getting pizza in here, she said. Not yet. He blinked, looking past her now as if checking the rest of the room. His eyes landed on Cole's white coat, on the nurse at the monitor, then on Maya. You, he said, voice thin. Maya found herself straightening. Yeah, she said softly. Me. You were there, he said. In the lights? You said you had me? A vague memory, half dream, half fact. Her words back in the trauma bay had traveled with him through sedation. Maya swallowed. I guess I did, she said. He stared at her for a second longer, then his eyes drooped. The effort of staying awake and talking had pulled at whatever reserves he had left. Let him rest, the nurse said gently. His mother sank back into the chair, one hand still on his arm, fingers tracing the bruises from the IVs. Cole stepped back, exhaling. His neurostatus looks good, he said quietly. He's making sense. Maya knotted her throat tight. That is on you, he added. She shook her head. That is on a lot of people, she said. Surgery, ICU, EMS, you. And you, he said. He let the point sit there. Outside the ICU room, the hospital moved at its usual speed. Food trays rattled down the hall. A TV in the family lounge played a morning show on low volume. Two residents argued softly over lab results near the nurses' station. Later that day, a story popped up on one of the hospital computers in the staff room, the browser left open by a respiratory therapist on her break. Local teen survives near fatal shooting in Southside. Under the headline, a grainy photo of Jamal in his basketball jersey number 11 shining under gym lights. The article spoke of a promising player, a stray bullet, a dangerous night in a winter storm, a remarkable effort by the trauma team at St. Gabriel. There was a quote from administration. There was a generic statement about teamwork and excellence. There was no mention of a nurse with her hand inside a dying boy's abdomen. Maya read it once, leaning on the counter with a cup of tea this time instead of coffee. She clicked the tab closed. She preferred the view from the ICU door. That evening she walked past Jamal's room again after her shift. She was off the clock. Her badge hung in her pocket instead of around her neck. Her feet hurt. She smelled like hospital and the laundry detergent they used for scrubs. Through the glass she saw Jamal sleeping. The oxygen cannula sat lightly under his nose. The monitor's numbers glowed soft green. His mother dozed in the chair, head tipped back, mouth slightly open. A half-empty styrofoam cup sat on the windowsill. A blanket from home, navy blue with a gold logo, was draped over her legs. Maya stood there a moment, watching the even rise and fall of Jamal's chest, the steady line above his head. Her own breathing matched his for a few cycles. Then she turned away and walked down the hall, the sound of the monitor's calm beeping following her until the door swung shut behind her. 3 weeks later, the snow at the curb had turned into low, stubborn ridges of ice gray at the edges, hollow underneath, where meltwater had carved tunnels. St. Gabriel wore the season with less drama now. The ambulance bay was still busy, but the storms had moved on. Inside the bulletin board, near the staff elevators, carried its usual clutter of flyers and memos. Between a notice about flu shots and a charity bake sale, a new sheet of paper had appeared. Grand rounds. Trauma case review, speaker Dr. Adrian Cole. Case, penetrating abdominal injury with prolonged resuscitation. Someone had added in pen smaller letters underneath. Featuring field adjunct techniques. Do not be late. The lecture hall was fuller than usual. Residents filled the middle rows, white coats and notebooks, a few with coffee balanced on their knees. Nurses sat together along the side aisle, some still in scrubs, others in street clothes who had stayed after night shift. A handful of attendings took up the back, their expressions politely skeptical. Maya slipped into a seat near the end of a row next to Priya. Her badge was clipped to her pocket. Her hair was still damp from a quick shower in the locker room. You did not have to come, Priya. Priya murmured. You told me there would be free muffins, Maya said. There was one on a folding table near the door, looking slightly dry. Priya's mouth curved under her mask, which she had not bothered to remove. Also, she said, this is your show whether you like it or not. Maya looked down at her hands folded in her lap. The scar on her wrist had faded back to its usual pale line. The bruised feeling in her arm was long gone, replaced by the occasional ghost ache when she thought about that night. The hum in the room cut down as Cole stepped up to the podium. The projector screen behind him displayed the hospital logo over a plain title. Case study. Hemorrhagic shock and penetrating trauma. He wore a suit instead of scrubs tie straight this time. His expression was its usual composed version, but his eyes moved over the audience with more awareness than habit. Good afternoon, he said. Thank you for coming. I know you are all busy. The standard opening. A few half-hearted chuckles at some remark about pager batteries. Then his tone shifted. I want to talk about one patient, he said. 18 years old, gunshot wound to the lower abdomen, brought in during a snowstorm, hypotensive but alive. He clicked the remote. An ultrasound image appeared, grainy black and white, with dark pockets pooling where they should not. Then a graph of vital signs, a jagged line plunging down over time. He walked them through the case. Arrival, initial assessment, the decision to wait for the OR that was not ready, the code that had stretched on, the flat line. He did not dramatize. He did not need to. The images and numbers did that on their own. When he reached the moment the team had called time of death, the room was very quiet. Even the rustling of muffin wrappers had stopped. This is usually where the story ends, Cole said, looking up from the slide. And if it had, we would have followed every protocol we currently teach. We would have documented everything correctly. We would have filled out the forms and told the family what we tell them in these situations. He let the possibilities hang there for a beat. He clicked again. The next slide was not an image, it was a simple line of text. What we did not have in our protocols: field vessel occlusion by manual compression. A murmur rippled through the room. Cole rested his hand lightly on the podium. I had a nurse in that trauma bay who had experience outside this building, he said. Estasham with he said. Outside this country. She had seen similar hemorrhages and settings where an OR was not 3 floors away but hours away. She suggested a technique that is not standard here. I initially declined, more than once. Several heads turned toward the rows of nurses. Maya kept her eyes on the screen. Cole continued. After we called the code, she asked for 2 more minutes, Vieg, he said. She explained what she intended to do. I weighed the risk. The patient was already legally dead. We agreed. He moved through the next slides. A diagram of the abdominal aorta, a crude illustration of manual compression points, a screenshot of the first irregular complexes returning on the ECG, the numbers climbing fragile but real. He did not glamorize the decision. He laid out the steps, the reasoning, the pitfalls. He showed OR images that followed the ligated vessel, the repaired abdomen. And then he said he woke up. The last slide showed Jamal in a hospital gown in the ICU, sitting up in bed. His face was still thinner than before, eyes a little too large, but he was smiling. One of his hands made a loose peace sign. His mother sat in the corner of the frame, half in, half out, caught mid-laugh. A few people in the lecture hall breathed out a sound that carried even if no one applauded. This case forced us to look at what we consider acceptable deviation from protocol, Cole said. It reminded me that the people in the room bring experiences from outside our own training. Sometimes that matters. Sometimes it changes the outcome. He paused. I could stand here and talk all day about clamp pressure and flow patterns, he said. But what changed that night was not just the vitals on a monitor. It was my understanding of who gets to put ideas on the table. He straightened, glanced toward the side aisle. Nurse Reyes, he said, would you stand for a moment? Every head turned. Heat rose up Maya's neck. Priya nudged her with an elbow. Maya pushed herself to her feet, hands briefly tightening on the back of the chair in front of her. She did not feel like someone to single out. She felt like someone who had once refused to let go. Cole looked at her. She was the one who took the risk with me, he said to the room. Her hands were literally inside that patient, keeping him alive long enough for surgery to happen. Any discussion about this case without her name in it would be incomplete. There was no applause. It did not feel like that sort of moment. Instead, there was something quieter, a shift in the way a dozen pairs of eyes regarded her. Curiosity, respect, a little disbelief. She sat back down, relief and displacement nodding together. After the talk, people clustered in small groups. Some argued about scope of practice and liability near the back. Others discussed anatomy at the front, gesturing at the projected aorta. A few nurses whispered with interest, tossing the phrase field occlusion around like a new tool they were just beginning to understand. Priya and Maya stood near the aisle, paper cups of water in hand. You are about to be very popular, Priya said. I am not a workshop, Maya replied. Priya arched a brow. Actually, you are, she said. Look. She nodded toward the bulletin board by the door. Another flyer had gone up. Crisis Innovation Series. Session 1, Improvised Vascular Control and Damage Control. Stabilization Lead M. Reyes, RN Facilitators. A. Cole MD P. Patel, BD2. May-D. The date was set for the following week. Someone had drawn a small star next to Maya's name. Maya stared at it. That was not my idea, she said. No, Priya said. It was mine. And Cole's and surgeries. Get used to your name being in print. I'm not good at teaching, Maya said. You are good at explaining while everyone is panicking, Priya said. Teaching will feel calm compared to that. They shared a look. It held a different quality than their first exchanges downstairs in the ER, less guarded, more equal. A few days later, the first session took place in a smaller conference room. A handful of residents and nurses gathered around a table where a plastic torso model lay its abdominal cavity represented in foam and rubber. Maya stood at the front with a clamp in hand, demonstrating the placement on the model. Her voice was quiet at first, but it steadied as she moved through the landmarks. People asked questions, good ones. Someone laughed when the plastic organ popped out unexpectedly. Cole stayed in the corner, letting her run the show. Priya helped adjust the ultrasound probe, pointing out flow patterns on the screen. The motif from the trauma bay repeated itself, but with less blood and more light. Later, back in the ER on a regular evening, Maya found herself beside a new nurse at the central monitor. The girl could not have been more than 24, hair in a braid, eyes bright with a mix of eagerness and nerves. A trauma alert chimed overhead, not a gunshot this time, a pileup on the freeway, multiple injuries. The department stirred. The new nurse watched the green lines flicker on the monitor, worry tightening her mouth. I still get lost in all the noise, the younger woman admitted. The beeping, the yelling. I am afraid I am going to miss something important. Maya glanced at the screens, then at the doors to the ambulance bay where red lights flashed faintly. You listen to the machines, she said. They tell you when something is really wrong, but you also listen to the body in front of you, the color of the skin, the way someone breathes, the way they hold their hands. That part is quieter. You have to make space for it. The younger nurse nodded slowly. It feels like too much sometimes, she said. It always will a little, Pamela, Maya said. You get better at deciding which part to hear first. An ambulance backed up to the glass. The door slid open. Cold air spilled into the warmth, bringing with it the smell of exhaust and the sharp taste of winter. Maya flexed her fingers once. Come on, she said. Let us see what they are bringing us. They moved toward the trauma bay together. The monitors continued their steady beeping. Outside in some rec center gym, a boy with a healed scar on his stomach might have been picking up a basketball again, palm-fitting to the worn leather breath, pulling in and out without a machine's help. Inside St. Gabriel, work went on. Hands reached for gloves, for clamps for one another. The snow would melt eventually. The sound of a heartbeat on a monitor stayed the same. Thank you so much for listening to today's story. If this story resonated with you or made you reflect, I'd love to hear your thoughts, so feel free to share them in the comments below. And don't forget to like, subscribe, and hit the notification bell so you won't miss the next story.